Downtown East Side resident Smokey D says when drug users can't get their supply through a doctor, they turn to the street.
And they just go out right out here and do mystery drugs and stuff, right? You know what I mean?
Mystery drugs that can be deadly.
They're taking absolutely toxic. We had 4 overdoses here yesterday, and the supply here is absolutely toxic.
The government's new public health order is designed to help prevent more deaths. It gives registered nurses and registered psychiatric nurses new abilities to prescribe pharmaceutical alternatives to street drugs. Nurses are more accessible for patients who can't see a doctor right away to access drugs like methadone or hydromorphone.
So it would have been a great opportunity for me to be able to initiate those prescriptions.
Sorensen doesn't work on the front lines anymore, but says the new abilities are welcome to help with the public health emergency. It's a crisis that's happening throughout the province, far from the visible drug use of the downtown east side. Since COVID started, overdose deaths have skyrocketed, primarily in private residences.
And nurses are experiencing issues with patients struggling with substance use and the opioid crisis across BC.
The BC Liberals say the health order isn't enough. Party leader Andrew Wilkinson says the NDP plan is too focused on harm reduction and doesn't provide a pathway to get people off drugs. Smokey D says it's a good start.
You know, everybody thinks like, oh, you're just enabling people, blah, 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 right? But that's not the truth. I mean, you got to do something, right?
Nurses will receive training and the government hopes to roll out the new powers as soon as possible. Mickey Cowan, CBC News, Vancouver.